Good evening, everyone. Thank you for joining us tonight. So tonight's live stream event is the final session in our series, Primary Care Response in Residential Aged Care during COVID-19. So tonight's topic is Taking the Helm, Leadership in Times of Change. So my name is Charles Broadfoot. I'm one of the PHN Education Officers. I'd firstly like to acknowledge the traditional custodians of the lands in which we're all meeting tonight, pay my respects to elders past, present and emerging, and also welcome our Aboriginal friends and colleagues who are joining us online as well. So tonight's session is being recorded and the recording will become available in the next few days on our website. So we do have a new website, if you want to check it out, it's thepHN.com.au, and you can access this recording and all of our previous recordings by clicking on the Education tab. So we will be using Slido for questions this evening, as well as the evaluation poll. So you can ask questions by typing them into the Q&A panel, and that'll be on the right-hand side of your screen. You can also alternatively head to slido.com and enter the code PCR4, so that's Primary Care Response and the number 4. You'll also see a QR code pop up on your screen. I'm sure you're all very familiar with that over the last few months particularly. So if you scan that code, there'll also be another way you can access the questions pane. So type your questions in at any time throughout the presentation. We will have some time between presenters, but also have allocated some time for a panel discussion at the end. So I'd like to introduce tonight's facilitator. So Dr. James Wolstenholme is a GP from Mingara Medical. So James is remoting in tonight from the Central Coast. So thank you, James, for facilitating, and I'll hand over to you.
Thank you, Charles, and good evening, everyone. Welcome to the meeting. We'll shortly be hearing from our first speaker. We have first Michael Fahy, who's the Nurse Manager, Clinical Practice and Leadership, Nursing and Midwifery Services at Hunter New England LHD, followed by Lynn Bickerstaff, who is the District Director of Nursing and Midwifery at the CC LHD. Before we get to Michael, I'd like to start by acknowledging the role of our local aged care facilities in keeping COVID out of the facilities so far, and the huge amount of work that they've done in preventing outbreaks, preventing transmission into our most vulnerable populations. I've seen it firsthand at the facility that I visit, and there's a lot of work behind the scenes on screening visitors and policing the lockdowns, as it were, and monitoring visitors and staff as they come and go. And I think we don't have to look too far to see how bad it could get if COVID was to get into one of our nursing homes. So I think it's important we acknowledge that. I think the main challenges facing GPs at the moment is, along with other health professionals, is that maintaining the vigilance over COVID. I mean, we've been dealing with this for approximately a year now, and it's easy to let our vigilance slip, I think. But again, we don't have to look far to see what the consequences of that would be. And I think it's very important that we encourage high levels of vigilance for screening symptoms in our facilities and communicate that with the staff there as well. There's also the challenge of continuing to provide good clinical care to the residents in aged care, particularly if, as most of us probably have at one time or another, we've had to isolate ourselves pending COVID testing results. And so that brings with it its own challenges. Thankfully, the use of telehealth goes a long way to helping us deal with that, but it remains challenging nonetheless. There's also the issue of supporting the mental health of residents, many of whom have had very limited contact with family now for the best part of a year at least. And again, I've seen that firsthand in the residents at the facility that I visit, that some of them have definitely struggled without their regular contact with family. And I think for some of those people, the GP is perhaps a familiar face when others have not been able to visit them. I think probably the biggest challenge, though, is actually what a GP's role would be if there were to be an outbreak in the facility. And there's been various suggestions about that, some of which I think perhaps are more aspirational than practical. But certainly I think GPs are well placed to be involved if that can be managed logistically. And that's one of the things that I'm sure will come up later in our discussion. So that's kind of where we are now, I think. And to take us into the first speech, I'd like to hand over to Michael, who is going to talk to us about speaking up and creating a safety culture for effective leadership. Thank you, Michael.
Thank you, James, and thank you for the opportunity to speak to your network this evening. As James said, my discussion for the next 20 minutes is Hunter New England Local Health District's experience of implementing our excellence framework, which is a culture change framework. And the topic tonight is stepping up and speaking up. So I would like to acknowledge the traditional custodians of the many lands that we are meeting on today here in Newcastle, the Awabakal lands, and pay my respects to elders past, present and emerging. Just a brief overview for the next 20 minutes. I'm just going to give you a small snapshot of an overview of Hunter New England Local Health District. Going to do a self-reflection exercise on connection with why, followed by an overview of our excellence framework, our evidence-based leadership framework, and building an effective culture, the how and the what. Stepping up and speaking up, and some case examples here and some frameworks to utilise, and a discussion followed on by leadership and the opportunity for questions. As you can see in front of you, this is our map. This is Hunter New England Local Health District. So we are quite geographically spanned across the Hunter and New England area, here in Newcastle, right up to Moree and Tenterfield. To give you a background here, we provide service to over 950,000 people, of which more than 52,000 are Aboriginal and Torres Strait Islander people, and we employ over 16,600 staff. We have a tertiary centre based here in Newcastle with a mix of several large regional centres, smaller rural centres, that includes 12 multi-purpose services. Next slide here, this gives you an indication of a day in Hunter New England, a 24-hour period. And I'd just like to acknowledge that this data is prior to the pandemic of COVID-19. But just to give you a note, across our LHD, we have over 1,100 people attending our emergency departments. We have 619 people that are discharged from one of our hospitals every day. We have over 5,700 people receive care in outpatient clinics, community settings, or their home. 24 babies are born every day, and we have 181 people that have surgery every day. The question is, how do we facilitate an experience for the patient, the carer and the family and staff that is consistent, that delivers the right care at the right time in the right place? So this next exercise, I just want you to take a few moments. If you have a pen and paper in front of you, ideal. If not, a mental note. And I want you to think about and write down, or a mental note of the most 5 important people that are in your life. We're going to come back to that at the end of the presentation. And I also want to ask, what's your why? What keeps you coming back into health every day as a health senior clinician, leader and manager? I want to share my story. My why. I followed closely a childhood friend and his journey with brain cancer. His battle with cancer was lost in 2018. His 6-year journey was filled with many highs and lows, with great examples of healthcare experiences and others that could have improved. Living through this experience has cemented for me my role and influence as a leader, a clinician and a manager in health, and shaping the patient experience and outcome, and my role in developing and building the capacity of our health workforce. So I just want you to take an opportunity to stop and reflect. In front of you here is our roadmap. This is what we call our excellence program. This is our evidence-based leadership framework. So excellence happens by building the capability, of our leaders and our staff, and making sure everyone, no matter what role, is working in the best interests of the patient and the organisation we work for. Through excellence, teams adopt a series of proven tools and techniques that help them align goals, create greater accountability and consistency in what they do, and ultimately improve staff and patient experience. Excellence is a planned, disciplined approach that guides how we deliver care and services. It's implemented, as you can see here, in 3 stages. That includes aligning goals, aligning behaviours, and aligning processes. What you see is the roadmap here on the screen. It shows the whole model and how the tools and tactics of excellence work together to get better results. Today, we're going to explore aligned behaviours, and in particular, you'll see on the screen performance gaps. So I just want to describe what is culture. Put very simply, culture is how things are done around, in and within a service or a unit. It's the patterns, the habits and routines of practice. Each one of us makes up the culture, and so whatever our role, it's important for everyone to know that as an individual, our ideas and actions can change things. So I want you to think about, what does the culture look like in your workplace? And you'll see the image on this slide, culture and strategy. Really important to stop and look at the culture. We can have every process and strategy in place, but the impact that culture has on that delivery. So where's our governance? Where does it all sit? And building a respectful and effective culture. Well, it all comes back to our New South Wales core values: collaboration, openness, respect and empowerment. Our New South Wales Code of Conduct, our HNE Values Charter. We're a values-based organisation, and our excellence program has been in place now for several years. We also have a more personalised component for each service and unit, and that is our standards of behaviours and the processes and formats to speak up. So HNE Values Charter and Code of Conduct provide the framework for standards of behaviours demonstrated in our local health district. The standards of behaviour provide a deeper understanding of what the values mean. It's often people's behaviours rather than their attitudes which create a positive or a negative environment. These are the building blocks that we have in HNE to develop an effective culture. What purpose the organisational values serve. It governs professional workplace relationships, helps explain the way we deliver our services consistently. It guides us on how to behave, guides us in making our decisions, articulates what we stand for, and guides business processes, and it underpins the whole organisation. So why do we have standards of behaviours? And the next couple of slides, you'll see a working example of what they look like and how it is. So the behaviours are determined by the service, by the people that work in the service, as observable and teachable actions, and it reflects the core values. You'll see in the next image how that looks. Most importantly, they look at what is acceptable within the workplace, but similarly, what's unacceptable, and gives staff the opportunity to have a colleague-to-colleague conversation, certainly when those behaviours are exhibited in the workplace. So certainly there's a level of empowerment there. The empowerment starts with the manager in being able to facilitate this with their team. And it certainly assists new groups or team members to quickly adopt the agreed ways of working. As I noted before, it's often people's behaviours rather than their attitudes which create a positive or a negative environment. So what you'll see here is a working example of the above the line behaviour versus on the other slide, the below the line or unacceptable behaviours. I guess a couple of notes here, and you can see for this particular example how to have that discussion when those behaviours are observed is given to the team to take that control and empowerment. So most important thing here, this is a live working document. This is the DNA of that service. This is how they work to ensure that there's consistency within that service and providing the patient, the carer and the family with the most consistent service. It is at times public facing, so these may be displayed in a public area, and certainly that provides a level of higher accountability to the community in which they serve. They're used as a guide, particularly for new staff and orientation. And it is the platform and empowerment for colleagues to have those respectful conversations. And it gives joint accountability for the staff member and the manager. So how do we describe speaking up? What is it? So speaking up is a way of communicating professionally and respectfully. It provides an environment where staff can work as a team in a harmonious environment, where people feel empowered to discuss issues, where there is a fear of safety or workplace harmony being compromised. So where do you speak up? We have a number of opportunistic areas whereby a staff member can speak up. We have integrated into practice such forums such as safety huddles. Other opportunities, obviously it's setting the right environment in a safe environment to have those colleague to colleague conversations. And what's advised is the conversation occurs as soon as safely after the incident occurs. And you will see the framework in which we support staff in doing. But we have to also look at the examples of what a culture can permit. So the next slide, I just want to touch on what a culture can permit. Now this is a photo here, and it's pictured here of what a culture permits, Roger Dean. For those who, the background story here, Roger was employed in a residential aged care facility in Sydney, and in November 2011, he used a cigarette lighter to start fires into nursing home beds and then watch the fires take hold. Later, the rationale, what was discovered, was Roger set fire to cover up his theft of a large amount of painkillers. The outcome for this was significant loss of life. 11 residents lost their life. And certainly what came from this circumstance was crushing on many levels. So when we talk about speaking up, the questions as health senior clinicians, leaders and managers, the questions we need to ask ourselves, what is the impact if I can't or I won't speak up? What can I do to promote a climate that makes speaking up easier? And what the role of the leader manager is in that? And how can we speak up respectfully? I just want to take you through the next slide. This is the Escalating Workplace Disharmony steps, and you will see it's inclusive of 5 steps here. And it starts with discomfort, and the definition of discomfort is things don't feel right. It's hard to identify the problem. It feels uncomfortable and unsure, right through to crisis. Now, I just want to talk about, let's talk about the case of Roger that we've just spoken about. In that particular incident, what was found throughout the review was his colleagues had concerns. They did feel uncomfortable. Was there a format there to be able to speak up and escalate the situation? I guess we won't necessarily quite know. But where we talk about how and when should we be speaking up if we were to have it at a guess, at what step should speaking up occur? Well, it should occur at the discomfort stage, at the first step. By having that open communication early on, when we are feeling uncomfortable, can help de-escalate an issue. When we get to the next couple of steps, for example, misunderstanding, so I'll describe that. It's an assumptions are made. People perceive the motives for the behaviour in a selective way, and facts are confused. At this point, we may begin to label the person, we make assumptions, and can then become a part of that triangle or that situation that we want to avoid. So what have we promoted in our local health district, and what's the framework to speak up with our colleagues? It's called the 2 challenge rule. So it has 3 steps. First is being able to question with curiosity. You may actually see in questioning with curiosity a change in that person's behaviour there and then. Similarly, if there is no response to that, it is that question with concern. So relating back to, it may be that particular service's standards of behaviours. The behaviour that is observed is below the line. Similarly, if there is no response to that, it is introducing a third party, and generally that is the manager or delegate within that service, to ensure that things are managed in an appropriate time frame. So what we do know about the 2 challenge rule is generally 7 to 8 times out of 10, you will see a change in that person's behaviour if it is brought up at the time, in the situation, and it's rectified. Similarly, when it doesn't go quite so well, our next opportunity is what we call our DESC framework. So just being conscious, DESC stands for describing the behaviour. E stands for evaluating or explaining how the behaviour affects the performance within the service. S is showing or telling specifically the staff member what needs to change. And K, most importantly, is knowing the consequences of continuous behaviour that is below the line. So a couple of notes on that. That is a performance conversation that would be held with the manager and that staff member. This should be planned, and certainly being able to utilise the acronym, focusing on the behaviour and the consequences of that continued behaviour. What we have described, our governance and our framework, starting with our core values, our code of conduct, our H&E values and the standards of behaviours, this conversation can be facilitated in a respectful way for all parties that are involved. So I just want to wrap up and connect for our next slides the role that leadership has. Our journey that I have described in a very small facet today, our excellence framework certainly gives our leaders and managers the tools to be able to role model and lead within their particular services and models of care. In particular, over-communicating the why, setting the tone within that service, being able to coach on the run and give that feedback, being able to self-manage, coach development, provide some level of decision-making, innovation and change, and being able to communicate the vision for the service. When we look at the role of leadership, how do you impact the people that you are serving? So you impact the way people perform within your service by the clarity of your direction, the ownership and shared accountability and giving that empowerment, the provision of resources, the creation of an environment for staff to thrive, not just survive, truthfulness of feedback and consistent feedback, role modelling of the positive behaviours, and most importantly, practicing with compassion and empathy. What we do know is what you permit, you promote. What you walk past on Monday and review on Wednesday, what does that say? How does that lead and how does that role model? But what we do know, if nothing is done, nothing will change. So I want to come back now. I think I'm just on time. And I want you to reflect on your 5 most important people and what it is that you want for those 5 important people in your life. Similarly, it may have given you the opportunity to reflect on why you do what you do. And I'll open it up now to questions. There's a few references there. So thank you, and thanks for the opportunity to speak with you this afternoon. I'll hand back over to James.
Thank you, Michael, and thanks for taking us through those important principles. I think the thing that strikes me about that is how important it is to establish those principles ahead of particularly challenging times. Obviously, we're talking in this context about an outbreak of COVID in a nursing home. So I think for staff to be trained and brought across all those principles in advance of what are going to be more stressful situations, I think is very important. We do have one question which I think would be a timely one for Michael just now. This is from an anonymous questioner who says, during COVID, our residential aged care facility has adopted safety huddles, but it doesn't seem to have structure. How do we begin to introduce rules around discussion? I wonder if, Michael, if you could respond to that.
Yeah, absolutely. So our experience in our local health district, we commenced safety huddles approximately 3 to 4 years ago. So we just prior to that rolled out in what we call our patient care essentials. So that incorporates intentional rounding, care boards, our clinical handover, and our communication strategies of H8 and ISBA. Our later edition was safety huddles. So we do have a policy compliance procedure, which I'm happy to share. But in summary, what it is a short 5-minute stand-up meeting, identifying, most importantly, the risks to patient safety as well as staff safety. That may be for the next 2 hours, 4 hours, 8 hours. Our policy is that a safety huddle is conducted by the manager or delegate every 24 hours, so once a day. And we do have 7 steps that the manager or delegate can follow in being able to conduct that effective safety huddle. I guess my advice is really, really important that it's inclusive of the whole team. So your support team, your cleaning staff, everyone, so that the information is, number one, consistent, everyone hears the same message, and everyone's aware of the risks, but most importantly, for the manager or delegate to be able to identify the risks, and most importantly, what mitigating strategy is going to be put in place to support that risk for that next time period. But very happy to share our policy if that's helpful. Okay, thank you. So I will hand over now to Lynn Bickerstaff, and her presentation should be online now. So thank you, Lynn.
Thank you, Michael. Sometimes Michael is a very hard act to follow. When I'm sure all of you have read my bio, and you can tell by my bio I have many years of experience. But when it actually comes to presenting like this, I'm quite a novice, whereas Michael is very much the professional. I'm used to an audience that I can work in with, so Bear with me as I go into my second time of presentation. Firstly, thank you once again to the PHN for the opportunity to present to this group. I presented late last year, and I actually found the experience very rewarding, and not only from the opportunity to speak with you and present information to you, but I think there was a key message that I walked away with, and I took it back to my executive team, and particularly the directors of nursing and midwifery on the acute hospitals in the coast. And that was that we all agreed that your residents are our patients, but together they're our community. And we as a team are working as partners during 2020 and now 21 to keep them safe, to keep our community safe and to keep our staff safe. And I'd just like to acknowledge what Charles said in the very beginning. I think the residential aged care facilities across the Central Coast and across Hunter, New England, who the organisations are that we represent tonight, need to congratulate you and your teams with your GPs, with our teams that go and work with you on how you have managed what could have been a somewhat catastrophic event for us if we hadn't done it well. So I'm really looking forward to following on from Michael and perhaps sharing some of my story. I am an experienced registered nurse. I've traversed many pathways in those years, and over probably the last 15 years, it's been some of the most pivotal years in my senior leadership roles, but it's in those roles in the different organisations that what I'm hoping to bring to you tonight is share some of my experiences, and at the end I'd like to perhaps reflect on what my recipe as a leader is. So, and that recipe comes from my education, my experience, my interaction with teams, working with executive teams, and most importantly, I feel very privileged that over the last particularly the last 10 years, I've had the opportunity to work with some very inspiring leaders from different parts of the health system and the non-health system. Michael started with his why. I can tell you, my why for when I was 18 is very different to the why I have today for the position I have. When I was 18, you could go to nursing, you could do teaching, or you could go off and worked in clerical. And I had a personal experience, and I wanted to be a nurse. But within the first 6 weeks, the experiences I had, I went home to my mum and said, I don't think I want to be a nurse anymore, Mum. And she said, why? And the real why was, I grew up in an extended family, and I had a very close relationship with my grandmother. And the first ward that I got to work with after PTS was a female medical ward, but a lot of elderly patients' interaction with fractured femurs. And I'd actually seen the practices and behaviours of some of the nurses. And all I could think about, my grandmother's name was Mum. And all I could think about was, I wouldn't want my mum to be cared for by these nurses. And so my mother, we weren't described as a helicopter mum, but she was concerned that that's how I was feeling. So she actually rang my educator, and my educator came and had a conversation with me. And she said, all you can take away is that's not what you're going to be a nurse like. So what would you like my mum's care to be like? And so from that day, the educator reframed my nursing profession, and to this day, that nurse educator is one of my professional heroes. But my why today is really, I'm very proud to be a nurse, but it's about leading the profession of care, the art of caring and the compassion of care. And it doesn't matter where you're nursing, whether it's in an acute facility, a subacute facility, a residential aged care facility. And I have had the privilege to lead the profession and operationalise the profession across those systems. My residential aged care facility experience was in Victoria, where I had the opportunity to, and privilege to lead 5 aged care facilities that were owned and operated by Monash Health, one of Victoria's largest health providers. And it was there that I probably learnt more professional humility, and it was there that taught me greater organisational skills. And if you, am I allowed to ask him to go to Slido? If you go to Slido, I've got a question for you. What would you prefer, a pandemic or an unannounced support visit? Even 7 years on, I get a cold shiver if I think about that phone call around the unannounced support visits. I'm sure they've improved in the last 7 years. So I'm also hopefully will pick up some of the themes as I present to you this evening on what Michael's presented. And something that I'm very passionate about as a leader is actually leading culture change. But not change for the sake of change, but promoting and optimising the culture that we need for today. And next slide. It's not working. Oh yeah. Have I done it? No? Okay. So on the 1st of January 2020, when you're all thinking about your New Year's resolutions for 2020, lose more weight, grow 6 more inches, maybe dye your hair blonde, have a total makeover. No, we were horizon scanning. We were visioning what 2020 was going to bring to our workplace, to our team. But none of us had COVID-19 on our horizon. It wasn't something that we were planning for. In essence, we're very good at planning for emergencies and disasters, but very short-term emergencies and disasters. For many of us in New South Wales, and I'm sure it impacted on many of you, is that we went from October 2019, we were in disaster mode from 2019 through fires. And for those of us that were on the coast, we actually then went through a very traumatic floods. So we went fire, floods, and lo and behold, just to put the icing on the cake, we all go into an international global pandemic. And none of us could have, even in those first few weeks, envisaged what the next 12 months was going to be and how protracted it would be. So at that time, we had the leaders ready to take the helm. You may not have felt it at the time. We had the leaders that were ready to step up, and we had the leaders that were ready to lead the crisis, ready to lead their teams and their groups. And this is one crisis, and Michael's given you a framework for Speak Up, but I think we had the leaders that were there speaking up for us, for our patients, our community, and our residents. We were there ready to speak up about what was going to happen. And as each day emerged, what went well yesterday? What did we need to improve on? If we were given that same situation tomorrow, I think we all got into that habit of going, well, we've survived another day, but if we keep doing what we're doing today, will we survive tomorrow? Or what would we really like to do differently? Many of us will have different opinions, and I'm not sharing my opinion, but I think I can speak for many of us that when we walked the corridors of our organisations, but then when we went in the front door at home, there was a very mixed feelings about what we were doing in 2020. We had families to keep safe, we had residents and patients to keep safe. So we were really looking at our leaders to give us that direction and how are we going to get to this together. I don't know about you, but that's how I felt in 2020. Some days I didn't know what ball to juggle, and if I took one foot off the ground, it was all going to fall over. Michael asked you to talk about, your top 5 favourite people. Oh, don't show mine to anyone. I might not, might get divorced or whatever. But it's really hard, isn't it, when you have to pick 5 of your favourites? But use Slido if you would like to, because I'd like to take away from the night, I'd like to hear from you. Normally I would be questioning you in the audience, but if you could use Slido, and in 1 word, if you're an introvert, you can have 3 words if you're an extrovert, tell me, what was the best thing of 2020? And then, if it doesn't hurt too much, what was the worst thing of 2020 in your leading and managing the COVID response? On my personal reflections of 2020, when at higher levels within the local health districts, when the governments and the public health units were getting together and starting to get some sense of the situation that was emerging in China and then onto the shores of Australia and across the world, I can remember getting to my team and we automatically went into our emergency management systems. So we did that all really well. And then as the time progressed, the days and the weeks progressed, we started to really reflect on, the protracted time that this could potentially do. But I live in Newcastle on beautiful Lake Macquarie, and I travel down to the coast every day. And I have developed this little habit as I come up the Carry-On Hill every day, that I reflect on the day. But I'm supposed to stop when I get to the Carry-On Hill. By the time I get onto the M1, I've got to fight the trucks and I'm supposed to be focused. But I must admit, I think of all of 2021, I probably didn't stop reflecting on the day or the weeks or the months until I probably turned off the Pacific Highway at the Gunya Hotel there at Belmont on my way home. Personally, I've found 2020 very challenging, professionally and personally. As a mother, as a grandmother, as a member of the community, to some of my best friends who are battling cancer, to friends who haven't been able to see their family. The impact that we felt either personally you shouldn't dismiss it as not as great as someone else. And I know across the world there are many countries and many communities in a much worse position. But why I talk about reflection? Because I think it's really important as you're coming into 2021, as the leaders within your facility, your staff will be looking at you, and your personal reflections will start to shape and guide how you're going to go into 21. And if you're having honest and courageous conversations with yourself, it will actually forge around, am I going to invest in education? Am I going to look at other systems that I want to improve upon? But as the leader, your staff are continually looking at you for guidance and direction, so they need you to step up. But also, what you might need is some of your team to step up, and getting that from your reflections by a little notebook or by doing a big SWOT analysis, whatever your preferred method of reflection, whether it be quiet or active reflection, it's really, I would consider, one of the most important things that you do as a leader. I would like to say that in 2020, the partnerships, collaboration that the local health districts have done with the PHN, I think the leaders in the PHN, the staff of the PHN of Central Coast Local Health District and Hunter New England, I think we would all say one of the things that we want to reflect on is we don't want to lose what we built in 2020. We've built some great collaborations, we've got some innovative work. And if I'm speaking from my role on the coast, one thing I don't want to lose is the relationships that we have developed with our residential aged care facilities. on many fronts, not just from emergency management, but in models of care, how we can come in and support you to keep your residents safe in their own home. The other thing about 2020 is speaking up. I've had the opportunity to speak up in forums that sometimes I might have naturally just listened, but I thought it was really important that in my role that I am the voice of the nurses that I'm leading, of the patients I'm caring for, and the community that I'm listening to. And often I know Michael identified the speaking up principles, but one of the things, and that's about individuals and promoting the culture, but for us as leaders, the most important element of a speaking up culture is that you also have a culture of listening and active listening. And if you're encouraging people to speak up, then you must be committed to following through and showing them that you value what they're saying. Ongoing in my reflections of 2020, was it a career highlight or a career lowlight? Now that it's over, I don't think there will be... we might say we wished it never happened, but it did happen, so it's making sure that we make the best of it. And I think we should reframe it, that it can definitely be a career highlight, and see how did it reshape our career, or how did it reshape how we approach things. But even from our community perspective, we haven't had a flu outbreak this year. If we reframe, even just through different infection control principles and practices, reframe that safety culture, 2020 for us in New South Wales, in particular, I'll just focus on New South Wales, will perhaps have given us more benefits than what we realised. So, it would be remiss of me if I didn't put some sort of theory, just so that Michael doesn't make me look like I have no theory base. But I've shared with you a definition of governance, and it's probably a mishmash, but basically it comes from my experiences. And as we get to the end, I'll conduit why I bring these definitions in. Governance is a structure that provides the foundation of accountability. And as Michael explained to you within the Hunter New England framework, the excellence framework, it is the foundation of accountability. Effective governance systems will take away those barriers. It will give permission. It will set the direction. Most importantly, it will set the direction. It will set the standards that you want to achieve. Effective governance will also allow you to look at what resources you do have and ensure that you're using those resources for the right things. And most importantly, and I think from my experience, one of the things that we can really use from 2020, and I suppose some of us, particularly those of us working in public health, would say a big tick for 2020. We've got telehealth, we've got systems that we've been asking for 10 years, and they have been fast-tracked, and you know what? They were fast-tracked and implemented in the fastest time many of us can remember in history. So, the really good thing is we won't lose that. It will still continue to be part of how we service delivery and how we work together. So, but also showing to us, and I'm sure you've got many examples in your facilities around, well, we did this in 2020, it worked really well, why don't we continue to do that? And so your effective governance and your structure around that will actually help you fast track or really make quality and safety and improvement hardwired and part of your culture. Often we work around the definitions of leadership, and to me, leadership isn't something we learn from a textbook. It's a bit of an art, but we have to, many of us are in, often in management roles, and because of our management role, our managing roles are more effective if it's actually partnered with really high-performing, effective leadership skills and traits. And leadership isn't about you, it's actually about the behaviours that you demonstrate when directing the activities of a group towards a shared goal. And last year, I don't think any of us will disagree, our shared goal was to survive COVID-19, to keep our residents and our staff and our community safe. And I think you can probably look across the spectrum in New South Wales, and I'm sure many of you could identify local and even statewide leaders that really took us through that. Management sort of sits with governance, and it's often the technical skills. You have to manage your budget, you have to manage your people. But management is articulating and putting those technical skills into play so that it removes barriers and sets the direction, but allocates the resources. So that's the manager in you. But most importantly, we put leadership and management together because it is about meeting that goal, that shared goal. It could be the goal that's been set down to you by your board or by your local governance. But most importantly, as a leader and when you're working with your team, as Michael said, the most important thing is to give the why. You might know this is it, but you need to transform that into a language that at every level of your team, they understand the why. So if it's your nursing staff, your care staff, your cleaning staff, you want them to be, in our language, efficient with their resources. But when we talk to them and we want them to understand the why, sometimes if you put it into their world, it's about, we have a limited budget. And it's no different to our budget at home. We have to live within our means. Why do we need to live within our means? Because if we spend it all this week, we won't have any for next week. If we use the most expensive, if we eat steak every night this week, I don't even know if steak's an expensive cut of meat anymore, but if we do, then we're actually going to have to eat vegetables all next week. So I think it's really important, and it was one of the things that I really learnt when I was working with staff in Victoria in my aged care facilities. I had a real opportunity to commission a new residential aged care facility, and everyone thought that there was just an unlimited pocket of money. So when working through the staff, and particularly working through the change, it was about, I didn't get any wins until I had an aha moment and actually took it from my theory language and actually put it into a language where they understood it. And particularly a language in Victoria, if I was able to sometimes correlate it to an AFL match. So whether it's me in my role, Michael in his role, and importantly for our audience tonight, none of us achieve without our teams. And our teams can't achieve without what we put before them. That they do know what our goals are. They're very clear on the direction. They're very clear on what standards we expect. Most importantly, as human beings, they appreciate open and honest communication, particularly if you frame it in the right language, and that you frame it so it promotes a culture of inclusiveness and acceptance and not a blame culture. It's very important in whatever team you're running that you've got defined roles, whether that be a leader, a manager, a facilitator, a coach, or you're just members of the team. I shouldn't say just members of the team. The collective is the power. Using a sporting analogy again, in an AFL team, we have specialist members of that team. We have the forwards, we have the midfielders, we have, the ruck. We know we have lots of different people, but then we actually have specialist coaches. So we have coaches that specialise in the forwards, in the defenders, in how to jump high, how to jump low. So it's really important as the manager and leader that you put those foundations and those resources, and the excellence framework that Michael described tonight is one framework that's available to you that can give you guidance on how to put that together. I did work at Hunter New England for a few years prior to this role, and I can say with my hand on my heart, the Hunter New England Excellence Framework, which is based on accountability, what you permit, you promote, is an excellent framework, and particularly if you're trying to transform and take a team with you to a new part of the world that you want to be in, or if there's a new, if you want to say that here we are today, but really this is what I really want us to look like, and sometimes you do need that framework to help you kickstart and get all the direction in place. I think another key that I would emphasise is that mutual accountabilities, and accountabilities is if you're building that culture of safety, of quality, it has to be one of the foundations, because if people don't take accountability and responsibility for what they do, it's like what the nurse, the behaviour of the nurse that Michael described. And it's even now in common law, and it has been tested within the profession of nursing, that a poor culture is no longer acceptable for poor practice. So particularly for registered nurses, enrolled nurses and registered nurses who are leading aged care facilities, if by chance there are some incidents where professional practice is looked at, you should bear in mind that in 2019, I think the case law was presented, and that for our profession, it has often been used that the culture was the foundation of why the nurse practiced or behaved like this, but there is now really good precedent to say that that will no longer be acceptable. And I think for you as the facility leaders, putting that framework in place is really important. And I think, I will finalise that slide in just saying that we all have roles, and we need to coach, we need to teach, but most importantly, we listen and we learn. And often we're listening together. And from my experience, the most effective learning, I know we've moved into a new way of learning, but look at your team and look at what's the way they'll learn best. Because it can be great to say, oh, we've got 20 hours of online teaching, but at the end of the day, if that teaching doesn't convert to best practice, then we've actually wasted 20 hours of online learning. I think Charles is going to wrap me up. So I'm sure many of you last year said, a leader, who, me? Me, I've got to be the leader. It can be as scary as jumping off a cliff, but if we follow some principles, it can be a very rewarding pathway. For people that know me, I've never been a good cook. I'm not known for cooking, and when I was putting this slide together last night, my husband had a little chuckle, and he says, why are you using a cooking analogy? And I said, because I'm so over the sporting analogies. But here on the slide is my recipe, and it's a recipe that the basic recipe, you've often got a basic recipe for a fruit cake, but it's a recipe that I've probably adapted to the situation and the taste of my, the people that I'm serving my cooking up to over the years. But if you look at, there's some key principles, organisational structure, governance systems, leadership capability, the right staff with the right skills, most importantly, the resources that are fit for purpose. And for us in making sure that our residents have the best care It's quality and safety culture. We can teach the systems, but unless you've got the culture of consistent practice, you don't get the reward of that, the teachings of quality and safety. And as if 2020 has shown us nothing else, throw in some big cups of innovation culture. It's actually tasteless, I believe, so it won't influence the taste of your final product. But most importantly, you sometimes need to take time. It's a slow cooking recipe. It's not that you can say, I'm going to do it today and by tomorrow I'll have the cake, please. It does need to cook over some time, and you need to be patient, perseverance, and sometimes, as I know very personally, sometimes you take 10 steps back before you can take those extra steps forward. And that's me. Thank you. Thank you for the opportunity.
Thank you, Lynn. Just looking at the feedback on Slido to your questions about summing up the best and the worst of 2020 in one word, there's a strong emphasis on teamwork and collaboration on the best side of the column, and on the worst, it's a mix of fear of the unknown and the increased workload and stress that goes along with it. So I think that seems to me a good summary for the year. We have a question from Susie Madden, who has a lot of experience working in aged care. She would be interested to hear how other aged care facilities are addressing the issues of abusive and aggressive visitors and families. I don't know if Lynn would be able to respond to that, and then I have a question to put to Michael after that.
Okay, thank you, Susie. I'm answering just from my experience and my interactions with some of the facilities, but I also know it's our community has responded in very different ways, and even though our communications may have been reasonable, I think the flood of communications has left people confused, and then their personal behaviours. So really, I can't speak on behalf of the residential aged care facilities, but I do know that some of them have put in place, what's the right title for, like a concierge, and trained, the first person they see at the aged care facility, when they walk in the door, the first person they see, and it becomes a very welcoming, but also going through a bit of a, here where we are today, etc. But also how we go through the screening, making sure that it's with a bit of compassion. Oh, look, you're from the Northern Beaches. Unfortunately, because you are from the Northern Beaches, we're unable to let you visit today. But would you like to leave Mum a message, and I'll make sure she gets it? Would you like to FaceTime Mum? Would you like to sit here in the waiting room? So I think it's about understanding the why, once again, understanding why the aggressions come about, and is it just a one-off, or one of the facilities, this was actually a facility in Victoria that I just happened to catch up with, they didn't have a good relationship with that family from the very beginning. And so some of the restrictions that COVID then brought in then just exacerbated that poor relationship. So then they've had to involve some facilitators to help rebuild the relationship, which is hard also during COVID-19. But I think maybe, what are your communications? Do you give them regular updates? Have you got a Facebook page? Do you send them text messages? Do you give them a phone call? I think, if we look at some of the recommendations that came out of the New South Wales Newmarch House, if we look at some of the recommendations that are coming out of the Victorian aged care, families just felt they weren't communicated with. So I think it's about knowing your residents, knowing your family, and maybe coming up with not a one-size-fits-all, but coming up with different strategies. Hope that was helpful.
Thank you, Lynn. Yes, so certainly I think in my own experience is that often that communication is probably the most important thing, and a lot of families' anger comes out of fear or anxiety on the behalf of their families who are residents in the nursing home, and and I think that the staff and sometimes the GPs are there. They're just the first in line target. You can't go and shout at the government particularly easily, so you shout at whoever's in front of you, which is sometimes just the way things go. I'd like to go back to Michael for a question. It's an anonymous question. In fact, there's two parts to this. One of them, somebody has asked if you could provide some examples of how to question with curiosity and then concern, and then linked to that, the possible role of facilities in determining what's considered an above and below the line behavior, and is that an important step in terms of producing excellence in that area? Thank you.
Well, thank you for the double whammied question. Okay, so the first component of the question is to give some examples on how you would question with curiosity and/or concern. So I'll give probably an example that every manager could probably very much relate to, and that is particularly around clinical staff and punctuality to shifts. That's chronic. So they're not turning up on time for their shifts chronically, and the impact that is obviously having on service provision and their team. So having that discussion, I would reframe it in particular that the in-charge nurse would be having that conversation with their colleague. So Lynn, would you mind if we role modelled this?
Oh, I'd love to.
Would you like to be the manager?
No, I want to be the naughty nurse.
Oh goodness! All right. So I'm the in-charge nurse, and Lynn is coming onto shift chronically late, 20 minutes late every shift. So I'm the in-charge nurse. So out of curiosity, we would do this in a safe place outside, so it's a one-on-one conversation in an environment that's safe. So Lynn, the last 3 consecutive shifts I've been in charge, you've come on late. The impact has been we can't obviously do handover. And is there anything that we need to consider for tomorrow when you're on another morning shift?
Well, I don't know if anyone told you, but I did arrange to come late. So it looks like they didn't communicate that change to you.
So was that a discussion with our manager?
It was a discussion with the manager, and she
Sure.
said, Lynn, yes, I understand your situation,
Yep.
and yes, you're right to start at 7:30. So actually, I was 10 minutes early.
All right. Well, look, I'll clarify that with our manager, and I appreciate your honesty here. And for tomorrow, so what we have to incorporate is that you will be here about 20 minutes late. Is that what we're?
Yes, I'll be when I'm rostered a morning shift.
Yep.
My pay has been adjusted.
Yep.
I'm due to start at 7:30, but I'm hoping to get here by 20 past because I recognise that I hopefully, because often we don't finish handover till 20 to 8, so I was hoping that if I got here by 20 past, I could still get on the tail end of my handover.
All right. Well, look, I guess outside of this, we might just have a conversation with our manager just to ensure that there's that consistency. And look, John's in charge tomorrow, just so that he's aware, if that's okay. So in that instance, we've been able to resolve that, whilst we might have to introduce a third party, that being the facility manager, because obviously, as we know, communication, we spoke about communication and consistency. Obviously, we would have to take that offline and have that discussion with our manager and ensure that all parties are aware. But if things deteriorated...
So Michael really expected me to be belligerent, didn't you? You didn't expect me to have that. But I could be the real naughty nurse.
Yeah, because obviously if we didn't get a response then and some ways forward, I could then go in and question with concern.
Yeah.
So that would certainly be around obviously what the contract is of employment, and similarly if there wasn't a response then it would be escalating that to the manager.
Yeah.
But we got a good resolution quite quickly, and as I said in my discussion, 7 to 8 times out of 10 generally we can come to some resolution quite quickly if the conversation's had at the time with the person. So the next part of that question, sorry James, I'm going to have to clarify, there was the next component to that question.
Yes, thank you, Michael. It was a question about the facility determining what constitutes its own above and below the line behaviors as a step towards uh, excellence in that area. So, would you advise facilities draw the line on an individual facility basis? I think that's the question. That's the point of the question.
Yeah, so I guess just a really quick summary. The above and below the line behaviours are guided by the core values, so collaboration, openness, respect and empowerment. And it's a facilitated discussion with the team on what's important to them, and it's agreed upon. So a really good example, let's talk about a clinical service. The agreed is that everyone's punctual for their shifts. And that's an agreed behaviour that everyone is honoured, because if I was to have that conversation with Lynn, I could say, obviously, we've agreed as colleagues that that's important to us, and it's respecting our colleagues that are on night duty so that they can get home on time. Similarly, behaviours that are not acceptable, it depends on the model of care and the service, but it's what's important to them, and that they own the behaviours and then have the empowerment to have that discussion colleague to colleague when things are observed to not be acceptable.
Yeah. Am I able to jump in?
Go for it.
If you're working in a facility that perhaps, and you haven't had exposure or experience to doing values work, if you I think you can even Google it these days, there's a book called Hardwiring Excellence.
Yes.
And through Hardwiring Excellence, there's actually a really good step-by-step process in how you can do. Some people, above and below the lines is a trademark of Studer, but there are other that just do the values, and or other people might name it ways of working. And if you don't have a set of values from your board or your governance in your strategic plan, you can actually start some very good work with your team around what are values, and it can actually lead to really good discussions, because from my experience, the most important things, as Michael described, is that the values are actually developed as the team, because if they develop them, they then own them, and then you can have those accountability conversations.
Yeah.
Thank you. Thanks very much for that. Just two more questions. One of them is a quick one, and that's a question to both our panelists about whether the slides will be available. Obviously, the meeting itself is being recorded, but I think there's a question about whether the slides would be available for people to use within their own organisations.
No problem.
Yeah.
My slides may not be as useful as Michael's, but most certainly you can have them.
Yeah.
Okay, thank you. And then to finish, I would just like to come to a question from Catherine Turner, who has asked what Michael and Lynn and myself see as the greatest challenge for care in residential aged care going into 2021. I'll give you mine first. I think it's going to be about balancing COVID fatigue against the impact of prolonged lockdowns and the added complexity of how vaccination feeds into that. That I think is probably going to be, for me, it will be the biggest challenge. Setting aside an actual outbreak in aged care, of course, which would trump that should it happen. Hopefully it won't. But I wonder if Michael and Lynn would like to respond to what they think would be the greatest challenge this year.
Look, I'd have to endorse those challenges, and I think, and maybe it's an opportunity for the PHN to be a conduit about bringing greater partnerships to work with our residential aged care facilities. They are the challenges, but actually, if it's going to be as protracted as it could potentially be, because even without immunisation, it might end up like the flu. We'll have to continue to do it because with those variants are still an unknown factor. So I think if we're smart, what we'll do is take the learnings from 2020 and build it into business as usual. So the new norm is going to look very different. So what does the new norm look like? and how do we lead it? How do we lead and manage the change? And are there different models of care and systems of care that we need to work together, not just the residential aged care facility, but in partnership with your GPs, with your local public health systems, but with your boards and with your governance systems, and most importantly with your residents and families? I think the opportunity is to revisit, is going back with our residents and families, and let's all making sure that we're on the same page around our expectations of care. And I think as the landscape of residential aged care facility changes, that those care models are going to be so important going forward.
And look, I would echo everything that James and Lynn has said. And look, I think for 2021, absolutely, the vaccination and then the subsequent prioritisation and the rollout, and echoing Lynn's thoughts, particularly around how we're doing the best for our community and communicating that effectively with all stakeholders that are involved. And I think it's going to be a challenge for 2021. And yeah, I'll leave it there because I'm conscious of time.
All right, well, thank you very much. Thanks for staying with us. I appreciate we have gone a little bit over, but I'm sure you can agree that these panel discussions with our presenters are really beneficial. So also thank you to the presenters for staying a little bit longer with us. So yeah, thank you for joining us. Thanks to Dr. James Wolstenholme for facilitating, and of course to Lynn and Michael for generously giving their time tonight and offering such great insights and practical knowledge that I'm hoping you can take with you tonight. So there is an evaluation on Slido. So if you just click the polls tab on the right side of your screen, if you could take 30 seconds just to fill that out, we'd really appreciate it. We really value your feedback. All right, thanks again for joining us, and we'll leave it there. So thanks very much and good night.